Welcome, everyone. My name is Rachel Massey, and I'm the Senior Science and Policy Advisor with CHE, the Collaborative for Health and Environment. We invite you to drop a note in the chat introducing yourself and where you're zooming in from if you'd like to. Today's webinar is the first in a three-part series exploring the particular vulnerability of pregnant people, infants, and children to toxic chemicals, the disproportionate exposures to these chemicals among communities of color, and how choosing healthier building materials and building products can protect vulnerable populations. This series is co-hosted by the Collaborative for Health and Environment, Blue-Green Alliance, the Program for Reproductive Health and the Environment, and Healthy Building Network, in partnership with Green Building Alliance, the Center for Environmental Health, and the Children's Environmental Health Network. We have a few bits of housekeeping before we get started. For those of you who are joining by phone, we've posted today's slides on our website. You can download the slides by going to today's webinar page. You'll find the link in the upcoming webinars section of our homepage at healthandenvironment.org. And for those who are online, we'll drop the web page link in the chat now. Please type your questions in the Q&A box at any point, and we'll get to as many comments and questions as we can after the presentation. If you would like to activate closed captions, you can do that by clicking the button on the bottom of your screen. This webinar will last for an hour, and it's being recorded. Now I have the pleasure of introducing our moderator. Elgin Avila is Director of Occupational and Environmental Health and Equity at Blue-Green Alliance. Elgin is originally from Detroit, Michigan, and his passion for environmental health stems from his experiences and knowledge of environmental and social injustices that have plagued disenfranchised and marginalized communities both in the US and abroad. At Blue-Green Alliance, he works to bring a more just approach to environmental and occupational health structures and systems. He aims to ensure that vulnerable and historically marginalized populations engaging in precarious work are protected regardless of worker classification, and looks to highlight how precarious work and financial instability affect worker health and wellness. I must say that I have really enjoyed working with Elgin as we've prepared this series, and I'd like to invite him now to set the stage for this conversation. Elgin?
Good morning and good afternoon, everyone in attendance today. Thank you for that introduction, Rachel. We're excited to bring you to this webinar series titled Environmental Justice in Healthy Homes, Disproportionate Chemical Exposures and Safer Building Products. As Rachel said at the top of the hour, my name is Elgin Avila, and I'll be moderating today's session. This series will focus on how race, ethnicity, and culture plays a key role in the exposure to toxic chemicals and the expected severity or impact of chemical exposures on human health. These exposures can be attributed to a variety of materials in your home or place of work, and it is remarkably easy to be exposed to these chemicals. For example, hazardous exposures can be caused by general wear and tear of building materials, such as polyvinyl flooring. We see this in buildings with old paint or caulking that contains heavy metals being ground or chipped into dust. We see this in asbestos-laden walls or enclosures in old homes. We see this in phthalates and vinyl flooring and sealants in new homes and new constructions as well, and then a host of other materials found in both old and new construction projects. These exposures have led to a number of adverse health effects, such as hypertension in Black populations, adult asthma in US indigenous populations, diabetes in Hispanic Latina populations, and several others as seen in this scene and the corresponding infographic. Rachel, could you go ahead and click that for me? Beautiful. So in this series, we'll be focusing on how the built environment can be a source of hazards for workers and the inhabitants that live, work, and play in those buildings, and also how those who are particularly vulnerable to chemical exposure, such as pregnant people, infants and children, those with specific health conditions, to name a few, are disproportionately burdened by these exposures. This series will also touch on the procurement of healthier building materials for low income and historically marginalized populations, and also touch on what opportunities should we consider, whether it be policy or a program intervention, for example. Today, we'll be starting our webinar series with a discussion on environmental justice, or EJ, which I and most likely others will commonly refer to it throughout this webinar, and along with the built environment. or within the context of the built environment, excuse me. One of our guiding but broad questions for today: how do we comprehensively and holistically protect families from chemical exposures in our built environment? This webinar will provide an intro to the role building materials play in influencing chemical exposures for various subpopulations and communities. The speakers will focus on the impacts of these building materials all along the supply chain, exploring ways in which the manufacturing, use, and disposal, recycle, or reuse of building materials can contribute to chemical exposures. This session will also provide a brief exploration of the recent findings from the ECHO program. So as we said, we have two amazing speakers today, Rebecca Stam and Tracy Woodruff. I'm going to start with Tracy today. Tracy Woodruff is a professor at the University of California, San Francisco, and a recognized expert on environmental pollution exposures during pregnancy and effects on prenatal and child health, as well as on her innovations in translating and communicating scientific findings for clinical and policy audiences. Before joining UCSF, Dr. Woodruff was a senior scientist and policy advisor for the US EPA's Office of Policy. In addition, we also have Rebecca. Rebecca is a senior researcher at Healthy Building Network, where she leads a number of projects for HBN, investing the life cycle impacts of materials to drive transparency and innovation in this space. A great example of this work is the Pharos chemical hazard database. And prior to joining HBN, Rebecca focused most of her efforts on chemical engineering and has worked extensively in building product and chemical hazard research. With that, we'll turn it to our first speaker today, Tracy Woodruff. Tracy?
Hi, and thank you for that excellent introduction, and welcome everyone to this webinar series. I'm going to be kicking it off with an overview of some of the science concepts and why this is such an important series that Che is hosting along with PRE and the Healthy Building Network. And just as a preview, there will be a lot of excellent talks coming in the next series on the webinar series on interventions. So please join all of them. I have nothing to declare. Both also the Program Reproductive Health and the Environment and also our UCSF Earth Center. And I'm going to set the stage by talking about how the system to regulate toxic chemicals, those that are used in building materials and consumer products, is not working. And thus we are all exposed to many and varied chemicals. And in particular, communities of color and low-income communities have higher exposures to these chemicals, which put all of us in harm's way. And this is a challenge that we need to address immediately, because we are seeing a growth in the production of chemicals, particularly chemicals and plastics, over the last 50 years. This is data showing how we're seeing a growth in these, over a doubling since the 1970s. And this is large part also concurrent with oil and gas increased production. And what's also very concerning, and why this is such an important webinar series and topic in general, is that we're seeing a growing incidence of chronic disease in the United States, whether it's cancer, diabetes, neurological disorders. They've all been increasing over the last 20 to 30, actually 50 years, many of them in adults, but also concerningly in children as well. And genetics cannot explain this increase in disease. And we've seen that multiple authoritative bodies and health professional associations, including the American Congress of Obstetricians and Gynecologists and the Endocrine Society, have noted that chemicals can increase the risk for these diseases that we're seeing increasing in the population. So the challenge is big, because there are many thousands of chemicals and many thousands, actually trillions of pounds of chemicals that are produced or imported into the United States. This is data from EPA showing that there's about 9.5 trillion pounds of chemicals that are produced in the United States. That roughly translates into about 30,000 pounds of chemicals per person. So inevitably we're exposed to these chemicals, and they can include a variety of materials that are used in the built environment. So chemicals like PFAS, which are a stain-resistant chemical that can be used in carpets, flame retardant chemicals, which can be used in cables and other foam materials, phthalates, which are used in many different types of products, but also can be used, I think Eldon mentioned, so in Plastic applications include vinyl flooring, and then phenolic compounds, which can include BPA and parabens, which can be found in plywood. And this is just a fraction of the chemicals that we both measure regularly and understand their health effects. I just want to put the context, because this will be coming up in the later webinars, is that there are 40,000 chemicals that are registered for use in the United States. And these are chemicals that are also used in building materials. It's 350,000 chemicals registered globally. What I'm going to be talking about today, we have some good information on both on exposures and health effects, but for the vast majority of chemicals, we don't really know where they're being used or what their potential is to impact health. So it's an important gap that we continue to need to focus on to address. So because there are so many chemicals used and they're used in such high amounts, people are exposed to these chemicals. And we know that from many, many research studies that have measured these chemicals in people during all ages of all various ages, including during pregnancy and in cord blood of children. This is just an example from one of the studies we published actually over a decade ago using national biomonitoring data that's studies that's conducted by the government to measure chemicals in people. And we found that there were over dozens of chemicals measured in pregnant participants. You can see some of these, which I'll be talking about more today: flame retardant chemicals, perfluorinated chemicals, also chemicals that are more legacy chemicals, but they still hang around, for example, in caulk, like PCBs. And why we're very concerned about these exposures that occur during critical periods of development, because these are periods of development that can have greater these are times of great physiological change. So exposures that occur during these periods can have greater and unique influences on development and can actually permanently alter the trajectory of development. These periods include periconception, the prenatal period, infancy, as well as child and adolescence. And chemical exposures during these times can create a greater risk of adverse health consequences down the line. Some of these health consequences may not be measured, but can be measured immediately. So exposures during the prenatal period can result in adverse influences on birth outcomes. So for example, low birth weight or preterm birth. Some of the exposures may not be manifest until infancy or childhood. So for example, exposures that occur during the prenatal period can adversely influence brain development and lead to cognitive disorders such as attention deficit hyperactivity disorder, or increased risk or lower IQ. But some of them may not manifest till adulthood. For example, exposures during the fetal period can increase the risk of cancer later in life. And finally, what's also very concerning is that exposures that occur developmentally can be carried forward by the child and then a future adult, and then those effects can be transmitted onto the next generation. So pollutants can also have a multi-generational effect. I also want to point out that sometimes we talk a lot about children, and I know we love children, but there also is, we have to be very cognizant about the person that's carrying the baby also can be at risk for multiple influences from environmental exposures, because their body is also changing at the same time in order to nurture and support the growing fetus. So these include changes in mammary tissue to support future lactation, changes in metabolism and blood vessels, all in reordering and reorganizing in order to accommodate the growth and nurturing of the fetus. And so these changes are occurring also during a short period of time, 9 months, and some of them uniquely. I love the fact that the placenta is the only organ that grows and then goes away during a pregnancy. But this can put the pregnant woman at risk for other health diseases later if there is exposures to chemicals. So for example, changing in mammary glands and exposures to chemicals can put you at future risk for breast cancer. There's also can increase the risk of gestational diabetes and preeclampsia. And this is covered in a really excellent review by Julia Warchowski, who's now at Northeastern University. And I want to also position this because this series is about the greater effects in communities of color and low-income communities, as Elgin positioned this as environmental justice concerns, which is that exposures are distributed unequally in the population. So communities of color, primarily Black, Latinx, and Indigenous, and low wealth communities are more likely to live in polluted areas, whether it's from air pollution, pesticides, toxic waste facilities, etc. But we also know that biomonitoring studies show that there's disparate exposures to Black and Hispanic communities, meaning they have higher exposures to certain chemicals, particularly chemicals that can be found in building materials in their bodies. So there's a study, which I forgot to include this by Nguyen, which shows that pesticides, heavy metals, and chemicals found in consumer products and personal care products have higher exposures in non-Hispanic, Black, Hispanic women compared to non-Hispanic white women. We also can see that these higher chemical exposures in combination with higher burdens of chronic disease due to health inequities and other stressors, which can include financial and social strains, which can be due from a variety of sources, including racism and discrimination, and biological susceptibility, can all combine to contribute to the triple jeopardy of health inequities. So children also can have higher exposures to many different types of chemical pollution. That's because they have many things that they're doing that are unique or more increase than what we're doing. So for example, they consume more per body weight, meaning they drink more drink more and eat more per body weight compared to adults. But they're also doing things that can put them in contact with materials on the ground. So they're crawling around, they're exploring, they're putting their hands in their mouth. And why this is really important is that the things that they're doing can also put them in contact at a higher rate with chemicals, because chemicals love to migrate to dust. So dust is a sink in the home for many different types of chemicals that are coming out of consumer products and building materials that, as Elgin mentioned, can be degrading or wearing or other ways not really bound to those materials. So I just want to talk a little bit about this study, which was an excellent study led by researchers at Silent Spring, which aggregated data from multiple studies measuring chemicals in dust. So chemicals can get into dust because they can come from consumer products. So for example, flame retardant chemicals are used in foam, so they can migrate out of the foam into the dust. It can be in electronics, they can be in personal care and cleaning products. They can also be in building materials. So as we mentioned, phthalates can be in vinyl flooring, they can be in wall coverings, phenols are found, as we said, in some materials. They can also, flame retardants can be in insulation. The padding that's in carpet, PFAS can be found in carpet. These are all sources of these chemicals, and they can get out and about, and they've been measured in dust. And so the study found that they looked at about 45 different chemicals in these different groups, so phthalates, phenols, flame retardants, fragrances, and PFAS, and found these chemicals measured in varying amounts of dust samples from homes around the United States, for example, and about 10 of them were found in over 90% of the samples, and they were found at lower to higher amounts of chemicals in this dust. And why that's important is because children have these unique behavior patterns. They're crawling around, they're closer to the dust. They're also getting it on their hands, putting their hands in their mouth, and therefore can have increased exposure to dust. I also want to note that one item that's not covered in this is heavy metal. So an important one being lead. There's lots of studies showing that lead can get in dust, and that is another exposure route for children. That's why it's a very important area for focus. So here's an example of how this matters for the actual exposures to children. So this is a combination of two studies. And in these studies, they measured flame retardant chemical PBDE. So PBDEs is a chemical, a flame retardant that's not used now in foam, but had been widely used in foam, and it's also found in other electronics, so foam like in furniture or foam padding. And this these studies were looking at PBDEs measured in children in California. California also at the time of the study had a unique flammability standard that required a lot of use of these chemicals in foam materials. So this study looked at the exposures in California children who were ages 2 to 5. This is the level of PBDEs. And then this study evaluated PBDE chemical exposures in occupational settings. So these are people, adults who are working with have occupational exposures to PBDEs from either doing carpet laying or foam working. And what is really remarkable about this study is that you can see that the levels in children are very similar to those of occupationally exposed adults. And in part, this is due to children having these different unique behavior patterns that put them more in contact with the sources of exposure, in this case, dust or inhalation. So this is why we need to be concerned about these exposures in these materials into children. Also, this is an aggregation of some studies, including those by Ami Zoda, working with research like Rachel Morrow-LaFroche at Berkeley, looking at exposures in homes to dust, again, looking at PBDEs. PBDEs is a flame retardant chemical. It can get out of building materials or consumer products and into dust. And what this is a data from studies measuring PBDEs in dust from China, Europe, other locations in the United States, and California. You can see that the levels are lower and much higher in California. Again, there's the flammability standard. But what was really interesting about this study is that they did a comparison to PBDEs measured in houses in Richmond, California, which is a low-income community, primarily a community of color, and those were much higher than the homes of their white counterparts in Bolinas, California. So we have concern about exposure routes also to these chemicals. And now this is just to bring this up to contemporary level today some of this data is from more recently, is we can also see chemical exposures higher levels in Hispanic and Black pregnant women. This is from the study that was done as part of the National Institute for Health, Environmental Influences and Child Health Outcomes Program, or the NIH ECHO program. And in this study, we measured over about 100 chemicals using biomonitoring in the urine of pregnant women from multiple locations across the United States. And what we found is it's about 200 pregnant people. And what we found was that there were a number of these chemicals, again, similar chemicals that are used in a lot of these building materials, including phthalates and other types of plasticizer related chemicals. So phthalates that are well known, as well as phthalate alternatives, as well as parabens and these phenolic compounds, these bisphenol A's, there were higher exposures among participants who identified as Hispanic ethnicity and Black compared to their white counterparts. So the health effects of these chemicals, we've been talking about PFAS, flame retardant chemicals, phthalates, and phenols. For some of the chemicals in these categories, they're well known and established. We can therefore extrapolate to be concerned about the exposures for the other chemicals that are in these categories. And there's a number of different health outcomes that have been identified by authoritative bodies and or systematic reviews. And authoritative bodies, including the state of California, EPA, and the International Agency on Research on Carcinogens. So these chemicals have been linked or known to increase the risk of neurodevelopmental outcomes, so decreased IQ, increased ADHD symptoms, increased risk of cancer, increased risk of reproductive outcomes, so fertility challenges, influences on sperm quality, longer time to pregnancy, increased risk of metabolic disorders such as obesity and diabetes. And I think all of these chemicals have been shown to disrupt hormone levels in the body. So this is why we're so focused on identifying and addressing these chemicals and their sources as an area for intervention to prevent harmful chemical exposures and resultant health risks and health inequities in the population. So as a preview to what will be coming on, I want to say that it is a problem that we can address. So talked a lot about PBDEs, which is again a chemical that's been used in foam, carpet padding, furniture, and PBDs have been banned in the state of California, and they were phased out nationally in the United States in the early 2000s. But here, California would show you that California banned PBDEs in 2006. And this is from a study. It was led by Amizada here at UCSF, where we were able to show that the levels that we measured in pregnant women declined after the ban, about 40%. These pregnant participants, pregnant people were measured sequentially from 2008, 2009, 2011. This is only 3 years, and we still saw a pretty remarkable decline. So it just demonstrates that if we intervene, and in this case, it was a policy intervention, that we can reduce levels of exposure and have subsequent health benefits from that. So I am going to conclude with and turn it over to Rebecca. So exposures to toxic chemicals are ubiquitous, and there are health inequities in these exposures, and exposures occur during susceptible periods of development. And we know a lot of these chemicals come from indoor and built environments. And so we have an opportunity to address this problem, and it requires us to work in partnerships and to use our best available science to reduce these health risks. With that, I would like to thank everybody in the program in the Earth Center, and you can follow us on our various channels. Thank you.
Thanks, Tracy. Let me get my slides up here. All right, I'm happy to be here today to talk about safer product selection in the built environment for health and environmental justice. So first, just a little bit about Healthy Building Network, or HBN. We're a nonprofit organization with over 20 years of experience conducting research, developing tools, and broadly speaking, advocating for a built environment that is free of toxic chemicals. As we've already heard today, there are many reasons to be concerned about toxic chemicals and building materials. In addition to that, there is a huge quantity of materials that are being used and will be used. According to the UN Global Status Report in 2017, the world is projected to add 2.5 trillion square feet of buildings by the year 2060. So that's an area equal to the entire current global building stock. So given the unfortunate reality that many toxic substances are used in building materials, this dramatic expansion of buildings, not to mention upkeep of our current buildings, can either devastate people and the planet, or we can demand safe and circular products. So the US EPA estimates that people spend about 90% of our time in buildings. This includes the places where we live, where we learn, work, and play. So as occupants of buildings, we're all exposed to those chemicals that make up the built environment. But these aren't the only impacts of toxic chemicals used in building products. Toxic products and chemicals impact the health of people throughout the product life cycle. So this includes communities near where chemicals and products are made and where they're disposed of. And these communities are disproportionately people of color or low-income families. We know that decades of systemic racism and racist policies like redlining have resulted in a greater concentration of pollution sources, polluting industries, and contaminated sites in Black, Indigenous, and people of color or BIPOC communities. These disproportionate impacts are often referred to as Elgin mentioned earlier, environmental injustice or environmental racism. Toxic chemicals also affect the health of workers, including those who make the chemicals and products, those who install the products, and those who participate in demolition and disposal. And when these individuals are exposed to hazardous chemicals, as we've heard, this can impact their own health, as well as the health of future generations. For example, chemical exposures during or before pregnancy can transfer from mothers to the developing fetus, as Tracy mentioned. One study found that babies in the US are born with over 200 chemical pollutants in their blood. And these chemical exposures can have impacts throughout the child's life. There's also increasing evidence that suggests exposure of either parent before conception can lead to impact on the child's health. In addition, workers who use hazardous chemicals on the job can bring those chemicals home with them, exposing others in their home. So there are a lot of ways that we can all be impacted by hazardous chemicals in building products at each of the life cycle stages. In order to illustrate that, I'm going to go through a couple of examples, starting with petroleum-derived chemicals like plastics. Now, you may be surprised to find out how ubiquitous plastic materials are in our buildings. The building and construction industry is actually the second largest use sector for plastics after packaging, and plastic-containing products can be found in almost every part of the building. For example, did you know that most carpet is plastic? And many resilient flooring options are as well, like vinyl. Foam insulation, adhesives, and latex paints are also plastic. And these plastic products can have significant health impacts on communities and individuals throughout their life cycles. Starting with oil and gas extraction, refining, and plastic production that can have significant impacts on surrounding communities and the environment. These processes consistently release a range of toxic chemicals, including, for example, carcinogens like benzene. And these facilities are disproportionately polluting BIPOC communities, contributing to environmental injustice. In addition, the use of these toxic chemicals increases those communities' vulnerability to the impacts of climate change. Severe weather events like hurricanes, which are becoming more powerful and more frequent, can lead to additional releases that are dangerous for these communities. One of many recent examples, during Hurricane Harvey in 2017, dozens of chemical plants and refinery sites in the area reported over 4.5 million pounds of so-called excess emissions, above and beyond what they released during normal operations. Many of you may have also seen the recent news about the train derailment in Ohio and the hazardous chemical releases, including plastic input vinyl chloride. So when hazardous chemicals are moved between facilities using rail or pipelines and trucks, additional communities are put at risk. Plastic products also commonly contain hazardous additives that can be released and expose building occupants during use. Chemicals like phthalates and flame retardants that Tracy mentioned are just a couple of examples. Additionally, fence line communities can be impacted at the end of life of plastic products. Plastic building products are almost entirely disposed of at their end of life, so they end up in landfills or they can be incinerated. The landfill products can release those toxic additives into the environment, and burning of plastic waste generates additional hazardous releases impacting surrounding communities. Beyond those impacts, plastic materials also commonly degrade into small particles referred to as microplastics. These particles can be generated and released at every life cycle stage. A couple of building material examples are when plastic foam insulation is cut or sanded during installation, and paints when they're applied through normal wear and tear and removal. Paints have actually been estimated to be the largest source of microplastics in the oceans, so not an insignificant contribution. And researchers have only relatively recently begun looking for microplastics, but alarmingly are finding them everywhere, including in food and water, as well as in people in places like human placenta and infant stool. And exposure to microplastics is suspected to have a range of health impacts, including harms to fertility and respiratory health. But reducing the use of plastic products can help reduce all of these impacts on fence-line communities, on building occupants, and on the broader environment. For example, earlier I mentioned that carpet is made mostly of plastic, around 60 to 70% of the weight. And 2 million tons of carpet are discarded in the US every year. And less than 0.5% of that is actually recycled into new carpet. So that translates to over 1 million tons of plastic waste each year. And we hear a lot about the waste from single-use plastics, but the amount of plastic waste from carpet is about the same or greater than every water bottle, plastic bag, and plastic straw discarded in the US combined. So it's important to pay attention to these plastic building materials. And by avoiding them and opting for safer, longer-lived products, we can help reduce these impacts. The second example I'm going to go through today is about a group of chemicals referred to as forever chemicals. And this name forever chemicals refers to the large class of chemicals Tracy referred to as PFAS, per and polyfluoroalkyl substances. They're also known as Teflon chemicals, and they're used for a wide range of products for water and oil repellency. Within building materials, they can be found in a lot of places, including some paints and sealers, in fabric treatments, and one widespread use has been as stain repellent treatments for carpet. PFAS chemicals are released into the air, water, and soil during the chemical and carpet manufacturing. During normal use of treated carpets, PFAS is released into the indoor air and dust, which people can then inhale or ingest. Young children are seeing greater exposures because they spend more time in contact with the carpet and often place their hands in their mouths. And finally, when products are disposed of, that leads to additional PFAS releases. So as a result, these chemicals end up virtually everywhere, including, as I mentioned, in the indoor dust, in our drinking water, in food, and in people. The Centers for Disease Control and Prevention, which monitors Americans' exposure to certain chemicals, has detected PFAS in the blood of almost all people. Now, there are several thousand chemicals in the PFAS class, and very few of these have been studied for their health impacts. Those that have been studied are associated with a wide range of harms, including reproductive and developmental toxicity, endocrine disruption, meaning they impact how our hormones work in our bodies, and neurodevelopmental toxicity. Compounding those issues, PFAS chemicals can also be extremely persistent in the environment, which means they don't break down easily and are therefore capable of traveling long distances. So that's why these chemicals have been referred to as forever chemicals. PFAS can also bioaccumulate, and they transfer from mothers to babies. So it's easy to imagine how the adverse impacts of PFAS chemicals can be widespread and significant. Multiple studies have estimated the cost of healthcare expenditures and loss of IQ points due to PFAS exposures as being in the tens of billions of dollars in the US annually. And it's important to note that these costs aren't paid by the polluter, by the manufacturers, those making money on these products. They're being paid by ordinary people, by healthcare providers, and by taxpayers. But again, safer product selection matters, and it can have a significant impact. A 2020 study looked at PFAS levels in different spaces on a college campus. They considered offices, common areas, and classrooms, those with conventional materials, and those where carpet and furniture with PFAS were avoided. And the results were that those renovated rooms had 78% lower PFAS levels than a typical room. So the good news is that by making safer product selections, we can make buildings as well as fence line communities and workers safer. In the case of PFAS and carpet, pressure from individuals and organizations who buy products has led many manufacturers and retailers to phase out the entire class of PFAS chemicals. So as purchasers of products, as advocates for safer materials, it is really possible to make these changes in the safety of the products that are available. So how can we know what products and chemicals to avoid and which ones are safer? I'll just quickly touch on some resources to support safer product choices. Pharos, as Elgin mentioned, is HPN's independent database that compiles information on over 140,000 chemicals. It pulls together data from dozens of authoritative lists for human and environmental health hazards, as well as restricted substance lists from a range of different organizations. The database also includes information like the functions of chemicals within products in order to help identify alternatives that may be safer. And it incorporates a class-based or compound group approach to help avoid regrettable substitutions. The Pharos database also includes HBN's research into the content and hazards of over 200 different types of building products. And this database is used by scientists, researchers, retailers, and manufacturers in order to help understand chemical hazards and to make safer choices. The next tool that I'll mention is for people and organizations making or influencing building product selections. Informed is a method for product screening to help guide healthy product selection and can be used at all stages of building design. So far, we've developed this product screening guidance for 13 categories shown on the slide. And at a high level, this product guidance uses a simplified red to green ranking system in order to compare different types of products within a category. This ranking is based on HBN's research into the chemical impacts of products across their life cycles. We recommend avoiding product types in the red, which have the most associated material health concerns, and encourage preference for product types that are ranked yellow and green. And the important thing to keep in mind here is that anyone can take steps up the spectrum to safer materials. So even if you can't use those that are at the top of our ranking, even small steps up to better products can have a big impact. And I hope you all will join us in the next webinar in the series to learn more about that. And then finally, we also have a wide range of other resources, including specification language, case studies showing the use of safer materials, as well as in-depth research reports on a wide range of topics, including the intersection of carbon and health and the environmental justice impacts of insulation, which my colleague at NRDC, Veena Singla, will be presenting on in the next webinar. And with that, I'll thank everyone for being here today and turn it over to Elgin for the discussion.
All right, thank you both for that. So we will go ahead and start right at the top with the first question that was posted on the Q&A. So this particular attendee stated that there is also a concern about the land buildings are being built on. How can we protect families from this exposure?
Okay, so I think what they mean is that homes can be built on, hopefully they're not on current Superfund sites. So Superfund sites are contaminated lands that can be contaminated from dumping, which has happened either legally or illegally, or and also, well, actually, I guess you could consider also military sites have a lot of chemicals in the ground, which they haven't been cleaned up. So though I know that there's also actually some office buildings that are on lands that have been contaminated previously, like with chemicals like TCE. I think it's really challenging. I mean, some of these sites, hopefully, the government is responsible for identifying these sites and cleaning them up to particular standards. We'll note that sometimes those standards don't all keep up to date with the latest science. I think an example is trichloroethylene, which EPA did a risk assessment on. It's a few years old, but it was found that they had to lower the level of concern, and that there were office buildings that had challenges with TCE off-gassing from the ground and coming in the building. And in those cases, sometimes, those are best dealt with EPA and probably ventilation. But I think it speaks to the need to have up-to-date science for standards in terms of ground cleanup as well as mitigation prior to building buildings. And there's some other comments in the chat about this. I don't know, Elton, if you had any other thoughts, because you guys are in the building business.
Absolutely. Yeah, we certainly have some thoughts. I'll let Rebecca go ahead and answer this, but please, folks, please continue to add more comments to that chat. We'd love to see that. Go ahead, Rebecca.
Yeah, I was just going to add sort of from the future thinking perspective, in terms of how we can hopefully avoid contaminating more sites, is by making sure that the chemicals used in the manufacturing are considered as part of choosing safer materials, and that we're just keeping in mind the impacts that these chemicals have outside of just within the building.
Thank you for that. I'd say also another thing, certainly folks, we love to advocate for community members to be kind of that voice to really guide what kinds of interventions are being established for these communities. So for example, if we're looking at East Palestine and their concerns regarding the contaminated soil after their most recent disaster, what do community members feel is the best case for them to address the soil that's in that area? We can provide as many remediation options as possible, but what does the community ultimately feel is the most comprehensive and holistic solution for that? So ultimately, we at BGA will highly recommend going through that process first. And always communicating with all stakeholders available in order to create those holistic solutions. So I thank you for that question. So with that, I'll go to the next question. Is there a feasible way to protect lower class families from these building materials or these building chemicals?
Yeah, I think a couple of pieces here. One is HBN works with a lot of folks who are developing affordable housing in a wide range of areas in the US, and making sure these folks are aware and have the tools they need to be able to select safer materials to put into these buildings. Likewise with the upkeep of the current building stock for affordable housing. So there is a lot. Many of the people we work with in this area are wanting to provide the best spaces possible for the people who are living in them. Cost can be a challenge. Many safer materials don't cost more, but sometimes they do. In terms of first cost, material cost perspective. So I think there are policy levers on a local and a national scale that are necessary in order to ensure that those safer materials can be used in some cases, some of the trickier, more expensive cases in affordable housing sort of developments. And then also, we have to sort of flip the script in how we're thinking about cost. And think more holistically about the costs to society and who is bearing those costs of the manufacturing of the cheap materials and the toxicity impacts of those cheap materials.
Yeah, I just wanted to say this is really also an excellent reason why we need the government to regulate these chemicals that we know are toxic, because when they promulgate these regulations, the industry must innovate to reduce it, and it helps bring down the costs. And then it doesn't put the burden on the affordable housing community to try and figure out how they can go purchase these chemicals, right? Everybody has access to them. And I think this is really well exemplified when EPA put out the rulemaking on formaldehyde and pressed wood products. Benefit cost analysis showed that it brings formaldehyde, making pressed wood products comes back into the United States because a lot of facilities in the US are able to make the pressed wood products without formaldehyde, unlike other countries, and that it reduces exposures to formaldehyde, which causes asthma and respiratory symptoms and is a carcinogen. And then the benefits were therefore higher than the cost of doing the implementation, and then it helps improve the cost basis for people to use it. So it's kind of a win-win-win when the government does that kind of thing, even though the industry says, but they always will innovate to the bar. And if the bar is set to protect everybody, including environmental justice, but communities that are more highly impacted, then will just improve access to healthy materials while at the same time reducing exposures.
Thank you both. I really like kind of a central theme that y'all both mentioned here. Really looking at the entirety of the cycle of the building materials. At what phase or which phases are people being disproportionately harmed or are being exposed to hazardous exposures? So whether that's the disposal phase or the mining phase,
right.
That really gets to that comprehensiveness that we're really talking about here. So I really appreciate that from you folks. With that, we got time for one more question, so we can leave a little bit of time for folks to hear our wrap up. So I'll go ahead and pick this question here. Are there certain building products? Actually, we might be able to squeeze in another one, but are there certain building products that we should be paying special attention to as more money becomes available, for example, HVAC upgrades or, in schools, for example?
Well, that's definitely a Rebecca question.
Yeah, I'm not sure in terms of like specifically if we're talking about HVAC upgrades, other than to say sometimes insulation is used around HVAC ducts, and insulation products can contain formaldehyde-based binders or have other chemicals of concern that could potentially migrate into the HVAC system. So that would be something in particular from that perspective to keep in mind. Other materials that are replaced frequently or like you just use a large volume of, like paints and floorings, materials can be a good place to start as well.
Excellent. I'm going to put my response in the chat for the sake of time, but I'll move to this next question for us. How can tenants protect themselves from harmful building materials? I'll let you both kind of answer, but if we can, kind of keep it around that 30-second mark, just so we can end on time up here.
Yeah, I think as Tracy mentioned, like these chemicals love to hang out in dust. So one thing, if materials are already in place, is just to be cleaning up dust with a wet cloth, vacuuming with a HEPA filter if you can. So trying to remove that dust to remove the exposure route.
Yeah, we have a set of tips on how to reduce toxic chemicals in your home environment on our website. I just will say washing your hands also is helpful before you eat, and also trying to avoid other sources of chemicals so that you can reduce your overall burden. Using healthier cleaning products or less clean, water and vinegar for cleaning, as well as reducing your use of other materials. It is hard though, and that's why we're really bullish on the government making sure they're doing their job so that we don't have to do it all ourselves.
Absolutely. So with that, I'm going to go ahead and pass it back over to Rachel so she can wrap up our discussion today. Thank you.
Great. Thank you so much, Elgin, and thank you very much, Tracy and Rebecca, for these really excellent presentations. And thanks to the audience for the excellent questions and for the additional information that you've put into the chat. A quick few just announcements as we wrap up. First of all, a video recording will be available on CHE's website soon, and everyone who registered for today's session will receive an email with a link to the video. We also invite you to join us next week on Wednesday, March 1st at 11 a.m. Pacific, 2 p.m. Eastern for the second webinar in this series, Promoting Environmental Justice with Safer Building Materials. We'll be hearing from Dr. Veena Singla from the Natural Resources Defense Council, Dr. Robin Dodson from Silent Spring Institute, and Dr. Roberto Valle-Kinloch from Healthy Building Network, with Simone Early of the Massachusetts Bureau of Housing Development and Construction moderating the discussion. You'll find the link to register in the upcoming webinars section of CHE's webpage, and we'll also put that link into the chat. And then our third and final webinar in the series will be on Thursday, March 9th at 10 a.m. Pacific, 1 p.m. Eastern, and we'll focus on the role of federal regulations and resources. And we'll put that link into the chat as well. And I think those other two webinars may address some of the questions that have come up today. If this is your first time on a CHE webinar, just to let you know, we also host science discussion listservs and support other collaborative programs focused on promoting environmental health and justice. With that, I'd like to again thank Elgin, Tracy, and Rebecca for taking time to share this information with us today. Thanks to all our partners at Blue Green Alliance, Healthy Building Network, and the Program on Reproductive Health and the Environment, and especially to Jeff Hurley of Blue Green Alliance for all of his research and coordination and other work to bring this series together. Finally, thank you to CHE Director Kristen Schaefer for lots of behind-the-scenes support. Thanks to all of you for joining us today, and we hope to see you again next week.